The Northwest Council on AIDS says it has noted a report by Ritshidze which details findings about the delivery of health services in the province. The report flags poor turnaround times at clinics, resulting in long queues. Newzroom Afrika's Refiloe Seboko joins us with a full story. Refiloe, such an important theme and one that Zinyiko has touched on, particularly around the service delivery of health services here in Gauteng. What are the issues flagged about what it's looking like in the Northwest?
Indeed, Naledi, some of these issues are, one would say, long-standing, because even during the third report of Ritshidze, it had indicated some of those issues that talks to staff shortage, stock outs in terms of medicine, but also there was also a demand that there should be a provision of ARVs 3 months or to HIV patients. But it seems like some of those things, recommendations that were done previously, were not implemented by the Department of Health in the Northwest Province, which is some of those recommendations that once again Ritshidze is making to the Department of Health, to say that there should be a longer supply of ARVs to HIV patients, which is going to reduce the issues of long waiting times in facilities and also fill positions and gaps in terms of employing more health officials in more health personnel to these facilities that can also assist in terms of waiting time of patients. But let's speak to the AIDS Council in the Northwest Province, and I'm joined by Pastor Neo Mwepi. Thank you so much and welcome to Newzroom Afrika. Your response as the AIDS Council in the province to the report by Ritshidze.
No, thanks very much. We, as the AIDS Council in the Northwest, we want to appreciate that report and note that indeed there's a report of Ritshidze from the work that they have done. We have not yet sat down on the report to interrogate it and also engage the department intensively to also find their response. But yesterday, I spoke to the MEC for Health, I spoke to the HOD, I spoke to Meg Ritshidze, who is responsible for the major part of the program that relates to issues that have been raised by the report itself. And there's that undertaking that indeed 22 August we will have the Provincial Council on AIDS meeting, and the Ritshidze project management will be invited as part of the meeting attendees, so that we engage with this report, and prior that they must be, both of them be ready to bring their own reports that we must discuss. Not only the Ritshidze report, but also the responses from the Department of Health.
Let's talk to the issue of the demands for longer supply of ARVs for HIV patients in the province. It is repeating itself once again. Is that report by Ritshidze a true reflection, according to you as the AIDS Council, which ensures that some of these challenges with your focus are being addressed?
It's a fair call. The sector of people who are living with HIV in the AIDS Council, not only in the Northwest, throughout the country, have been making that strong call. One of the things that maybe as the AIDS Council we have failed to do is to follow up on the Department of Health, month by month, quarter by quarter, to find out as to how far are they to reach that expectation and that request. But furthermore, I think one of the things, the gaps that we are identifying, is that Ritshidze project, one way or the other, and the Department of Health, they are not able to sit down quarter by quarter to discuss the work that they are doing, their responses, and the speed in which issues are attended to, like issues of overcrowding in our facilities, how best can we resolve them, issues of people avoiding to default and people who are relocating from one place to the other, issues of systems and making sure that we are not missing out on our people when we are trying to manage HIV and AIDS comprehensively. But it's a noble call. It's something that must be done, because we believe that 95 must be adhered to by all parties, the patient, the department, and the general community itself.
And in terms of the general community itself, when you talk to and engage as the AIDS Council in the province, to patients and community as a whole, what are they raising and what is of great concern to them?
There are three key issues that, as we talk to them through the AIDS Council structures, from local to province, that we are picking up. One, it is the attitude that they are complaining about of our health workers. And one of the things that personally I did last 2 weeks, when there was an uproar on social media about the attitude of nurses in one of the local clinics, I went there personally to check as to what really happened. One of the things that I came across that alleviated my fears was that indeed there was an attitude, but the attitude was not just man-made. Our own people, when they arrive at the health centers, they arrive there angry, agitated, they want to get in a hurry, quick and stuff like that. And they don't want to be patient enough to understand what there are processes, there are people who are also there for other health services. You can't just arrive and get a service. The second issue that we have picked up is that indeed they complain about this shortage of medication, because among other things that we have found out as the AIDS Council is that other people, they arrive there not as people who are supposed to receive such treatment at that facility, especially in relation to ARVs. So one of the things that we have identified is the system itself. We don't have a system that is able to pick up, or a Newzroom is supposed to get treatment here, or he's receiving treatment there, and he has collected this treatment and stuff like that. Because we must be very careful to not to just give people ARVs all over. A person coming to a Lonely Park Clinic, go to Rustenburg, go to there, because ARVs have been found to be used on Nyaupe. So part of the things that we must manage is to make sure that we are giving the ARV to the right person at the right time, and we are not in a stage found at any stage to have contributed to ARVs being sold and being used in Nyaupe.
Let's leave it there for now, Mr. Moepi. Thank you so much for your time. Naledi, we'll leave it there for now. We're speaking to Neo Moepi from the Northwest AIDS Council. Also, some of the things that they have also noted as the council, as they are engaging with different patients and also community members. We'll leave it there for now.